Neurotrophic persistent epithelial defect. What's your approach? I want to hear from you guys. How do you manage a persistent epithelial defect in a patient who has a neurotrophic cornea? Now, neurotrophic keratopathy is a degenerative disease resulting from impaired corneal innervation. And in this case, you can see those greasy, mutton fat granulomatous graphic precipitates. This is a patient who's had herpes zoster ophthalmicus and they've got a persistent epithelial defect, but it's not healing because they're on loads of steroids for the treatment of that uveitis. And that subconjunctival hemorrhage is from a subconjunctival injection of steroid. Did you see that iridogenesis then? So look, you need to treat this patient with aggressive lubrication, non-preserved drops, check for corneal sensation. Sometimes you may even need to consider using other treatments. So in a patient who doesn't have an active infection, you may want to consider an amniotic membrane graft. There's many different approaches and it all depends on the underlying cause of the problem, whether or not there's any infiltrate, whether there's an infection. I recently had a patient who had a persistent epithelial defect due to exposure. They had an ectropion, and I just actually treated them last week with an Omni lens. That's an amniotic membrane and a contact lens. But guys, tell me, how would you treat it? And in this case, the answer is really tailing on the steroids.